introduce Justin, and then hopefully get a bit of an update to where we are from a state of play from last week, and then we'll be over to you guys. Hi, Justin. Can you hear us okay? Great. Okay. So Justin Varney, Dr. Justin Varney is our Director of Birmingham Public Health. So Justin, can you just give us a little bit of an update from where we are today from last week?
Yeah, so I'm afraid with COVID, the only way is up, and what we've seen is continual increase in rates. So in the public NHS dashboard, our rate up to the 6th of November was 287 cases per 100,000. And in terms of how that relates to the rest of the country, you are seeing areas that are topping 700 cases per 100,000. So we are going up, although our rate of increase is much, much slower than you would expect, and that's a good sign. That's reflecting all the hard work that people are doing to wash their hands, keep that space, wear a face covering, etc. In terms of the pattern of the kind of spread, we are seeing some differences now, and I think what we're seeing is more and more increasing cases across different age groups, and that is of concern. So you'll remember a couple of weeks ago, we were saying a lot of this was concentrated in the younger age groups, and now actually the highest rate is more in the over 30s, and we're starting to see a rate increase in the over 60s, and that is also then converting into more people going into hospital and more people being on oxygen in hospital or in intensive care. So we're starting to see those case numbers that rose a few weeks ago now converting into hospitalizations, and sadly we're also starting to see the number of deaths increasing as well. Now, when we look at some of the differences, one of the things I'd highlight is we're now seeing about 45% of our new cases are in our white community and about 45% in our Asian community. So that's quite different from where we were, say, in August, where it was much larger proportion were in our Asian community. And we are seeing a kind of slightly different pattern in terms of case rates around different parts of the city. So the highest case rate this week is in Heartlands, followed by Alum Rock, Aston's, Lozells, and then Yardley East and Perry Barr. So, a bit of East Birmingham, bit of West Birmingham, a bit of South Birmingham as well. So it's really dotted around the city. And, that really reflects the rise in cases we are continuing to see across the whole city. Finally, I suppose the thing I'd say just in terms of the pattern of spread is we're really seeing that this is spreading in households. So you remember, I think when I spoke to you a couple of weeks ago, I talked about germdefense.org, and I think really encourage people to promote that, and I'll put it in the chat as well, but it's a really useful website. It's in over, I think, 20 or 40 different languages, and it helps you work through in the context of your house how to stop the spread of the virus if it gets into your house. So we will see that. As Ricky said, the Prime Minister is currently on TV talking about the virus, so I'm not 100% sure what he's going to say. But I suppose what I would say is it is good news that the Pfizer vaccine has been shown to be effective at preventing people catching COVID. All of the trials are in that final stage at the moment of if you give someone the vaccine and then you expose them to the virus, do they catch it or not? So this is the first one through the gate, so to speak. However, we still now have probably 3 to 6 months before the vaccine is available in big enough numbers that everyone will have been vaccinated, and it will really make a difference. So although it's good news today, and it is really, really good news, it's not going to change anything until probably the late spring. So I think really important to just recognize that. It is a good step forward, but it's not going to change things in this calendar year. And we've just got to be kind of practical about that. The other thing in the news you will have seen is the stuff going on in Liverpool with mass testing. There aren't any plans at the moment to roll that out in other cities. It is very much a pilot, but there are some new technologies they're using. So there's a thing called lateral flow test, which is a bit like a pregnancy kit, but you still use the same swab, but the swab then has to be put into a little phial of liquid, and then that phial of liquid is connected with the pregnancy test. So it's not straightforward, and unfortunately at the moment it's not something that you can do for yourself at home. You would have to go through a testing site. So we're just getting the information about that coming through and starting to work that through. What would that mean? How would we set up those testing sites? And starting to build our thinking towards that. And I would expect to see that starting to appear around December time. But in the meantime, there's plenty of testing slots available in the city for people who've got symptoms. There's financial support, people on low incomes who are asked to isolate because they have COVID or because they're a contact. So it's really important that we make sure people are accessing testing when they need it, and most importantly, isolating to stop the spread of this. But I'll pause there, Ricky, because I know there'll be lots of questions coming through as always from the champions.
Yeah, that's cool. I think there's a couple of a couple of scenario ones really, and then one in terms of phrasing. So one was that, so this has come from Debbie. So just above that, you've got the germdefense.org. We'll send that update in the guidance as well to you guys. That she's an awkward question that herself and her husband are in a support bubble for her grandparents. Her father-in-law had passed away 10 days ago, and they need to be the support bubble for another member. In terms of from the, sorry, my internet connection is playing up a bit. So they need to arrange a funeral and other paperwork. Can they be the support bubble to both of them? Obviously not at the same time, and are carrying on extra hygiene. I could just see you nodding your head at that point, Justin.
No, I'm really sorry, Debbie, and that's a really awful situation. So you can't be in a support bubble for two separate households. And you're really not supposed to change your support bubble, I'm afraid. Now, there are some exemptions on compassionate grounds, but that would be for arranging the paperwork of the funeral, etc. The only thing that I could say you could consider is if your mother-in-law or your mum moved in with you and joined your household. And that's not always easy. It depends if you've got a spare room. So in effect, one of your single parents moved in with you for the rest of this period, so until December, so you could provide that extra support to them in your household, and then you could still bubble with the other one that's living on their own. But you can't form a bubble with two separate single people households, I'm afraid. And I know that's awful and not the response you wanted, but I'm afraid that is the way the regulations are.
Okay, we got, I think Karen and Bill were talking about the practical use of germ defense, which was good. Adrian was talking about some of your phrasing at the beginning of it. He's referring to saying Wales today that seeing the numbers are falling, and we should see that at some stage. So, you open it up with saying, was that the correct way, Justin? You want to like to reply on that one?
Sure. So, well, I would say the only way is up at the moment. My hope is that in about 2 weeks' time, as these restrictions really start to bite, then we see that the only way is down. But what Wales are seeing is actually stagnation of their numbers. So they're not seeing a downward trend yet. What they're seeing is that the rate of increase has slowed or stalled. But they haven't yet seen a downward trend, and certainly not sustained over at least 7 to 10 days in a row, which is what we would want to see for those to be sure that we have got shifted in direction. So I would expect that the only way will remain up for us probably for at least another week, and then it should start to at least either stall or hopefully start to come down. But at the moment I'll stick with Yaz, but I might have to change my band in the next one.
Okay, lovely. So we're now getting insight in your music. So this is from Paula Burns, which is saying, what is the longest time that somebody can incubate with COVID-19 before developing symptoms?
Yeah, so let me unpack that a little bit for you, Paula, because not everyone will develop symptoms even if they've caught COVID. The vast majority of people do, but some people are what we call asymptomatic, and they don't develop symptoms, or they have incredibly mild symptoms they just don't notice. In general, if you've been exposed to COVID, you would test positive within 14 days of that exposure. Now, most people develop, the virus grows in their body, so they've been infected, it's living in their lungs, and gradually over about 3 to 5 days, they start to develop symptoms, but it can take in some people 10 to 12 days. Unusual after 12 days, but that's why the 14-day window is there. It's also why there's no point testing someone who's been exposed on the day they got exposed or the day after, because in general, even if they have caught it, it wouldn't show up in the test for at least a couple of days. So generally what we see is that people develop symptoms, 3 to 5 days, but it can be up to 10 to 12 days. If you haven't if you haven't got symptoms within 14 days, very, very, very unlikely to develop after 14 days. And that's why the 14 days is there for isolation of contacts. It's also why we don't bother testing people if they haven't got symptoms in those 14 days, because actually you could test on day 5 and someone could just be a slow grower, for example, and actually they develop symptoms on day 10. It's just because the virus has taken a while to really generate in their body and grow to the point where you can find it.
Okay, so we've got Anne Kelly here asking a question. She's in her 60s and volunteers once a fortnight in a homeless centre, which has been allowed to stay open with measures in place. Is this still advisable for her to volunteer?
Well, there is an exemption to allow you to travel for volunteering. What I would say is, if your only risk factor is that you're in your 60s, then it's probably okay. If you have any other health condition, so let's say you have diabetes or high blood pressure, then I would say for the next couple of weeks, you have to give it a miss and ask the centre if there's anything you can do from home. Can you help on the phone or anything like that? We really are seeing that the risk increases the older you are. I have to say, Anne, if you said you were in your 70s, I'd be much stronger on saying no. But I would say if you're in your 60s and your health is otherwise really good, probably okay. If you're any older, or if you've got another health condition, I'd say give it a miss for a couple of weeks, just while we're in this period of kind of high case numbers. And if, as Adrian said, I'm wrong and the only way starts to be down, then you can get back into volunteering before Christmas.
Sue Clegg has asked a question: with the new restrictions, working with youth during lockdown on a one-on-one basis allowed?
Yes, it is. So there is an exemption for one-to-one youth work. Again, the rule of thumb is if you can do it virtually or by telephone, do it like that. Don't look for the exemption. If it can be done effectively by another form, then you should avoid face-to-face in the short term. But there is an exemption for youth work. There's also an exemption for support groups, such as 12-step programs, for example. And there's lots of information on the government website about what you can and can't do at the moment.
Okay, Adrian's come in again, so he's basically saying it's a question for yourself. The government advice on visits to care homes has changed, including the statement that providers are best placed to decide how to deliver visits in their own setting. But on the other hand, that the risk assessment must formally take into account the advice of the local DPH. Are you now giving permission for care homes to allow visits where care plans suggest that visits are essential for the well-being of the resident?
Yeah, so you're right. The regulations changed at the end of last week, and there's been guidance coming out over the end of last week. We're currently going through that with our legal team, and then we'll give advice to care homes. So at the moment, I'm not giving advice. I'm going through the guidance and reading it through. At the same time, all the care homes are having to do quite a lot of work to work through the expectations on them, because it's not not kind of blanket yes, no. There's advice from me that says I think you should or shouldn't, But if the advice is you can, then they have to go through a very detailed process, because ultimately they are potentially liable if someone dies and because of them not putting all the risk management in place. So it's not a straightforward yes or no answer, I'm afraid, Adrian, because the guidance only came at the end of last week. And we're still trying to work through actually what does it mean, because it really wasn't actually that helpful in some places. So probably get to a position on that later this week. So I wouldn't be chasing your care home. If you've got relatives in care home, it's going to be at least another week before there's any shift of position.
Okay, we've got a question from Steve Slavinsky, which is: are we concerned regarding the Denmark mink COVID strand and many lorries that came to Brum before they were stopped?
So yes, I am concerned about the mink strain. What I would say about the mink strain, so first of all, you'll know that flu, for example, influenza can jump from humans to animals. So we've talked about bird flu, we talked about pig flu. Looks like COVID can do the same. And this is the first example of it doing it to minks. Now, fortunately, we don't farm mink in the UK, so we don't have a lot of minks. And those that we do that are feral, so they don't tend to mix with humans. And since it became identified last week, there was a complete lockdown on people traveling from the part of Denmark where this was. It's a very specific part of Denmark called Jutland, where all the minks farms are. And the spread to humans and from humans to humans has been restricted to that particular part of Denmark. It's not all over Denmark. There is a process that's going on with the border force at the moment, tracking down anyone that's come from Denmark in the last week, and making sure they are isolating and they've got the right advice to protect themselves. And that's being done through the kind of port authority side. And there is a whole kind of national mechanism. Fortunately, not a huge number of people go back and forth directly between Denmark and us. But it is an area where there's been very, very specific work to follow up because we are very concerned about it. The mink variation has a slightly different appearance to normal COVID in a sense. I suppose the way I describe it is it's a bit like COVID wears a jacket, and the mink version of COVID, its jacket's got different buttons on it and is a different fabric. And the concern is that then the vaccine wouldn't necessarily work because it wouldn't see the same jacket, if that makes sense. So there's a lot of looking at this, and that's why there's a huge amount of work globally to make sure this mink variant doesn't spread. There's also more work being done globally to check that there isn't transmission into other forms of animal. So it is watch this space, but it is an area of concern.
Yeah, I was just seeing another headline from what Boris Johnson was just basically saying regarding the vaccine, just jumping out saying that we're in very, very, very early stages of this as well. So we need to kind of obviously temper our expectations to start off with. Okay, so this going back to the question, which is from Chris Milton. So Chris Milton is a chaplain. Appreciated your comments regarding on the session with Reverend David B. Thank you. It seems busier this lockdown, especially kind of off comments when you see some of the traffic. People relate to the traffic that the roads are still busy. Any ideas why? And he's concerned of how busy it seems to be going in some supermarkets. Is there any other route to highlight than going through the council?
Yeah, I mean, it's interesting. So I would say some things are busier and some things are a lot quieter. And I think, as many of you know, I live in the centre of Birmingham, just by the mailbox. And, over the weekend, I went off to Tesco's just up from Grand Central. And it was really, really quiet. Like the difference this weekend to last weekend in the city centre was a lot quieter than it had been. That being said, I think, during the first lockdown, we were all reliant on home deliveries. The home delivery capacity was much less. All of that, people were stockpiling. I think this time people are just approaching it slightly different and going, I can still go to the shop, so I don't need to do all my shopping at once. And so they're popping out more frequently, perhaps, than they were last time. So I think that's some of what's going on. We are raising both locally and nationally about the supermarkets being responsible in their management of how many people are inside the building and all of those things. Where you do see bad practice, do report it to the council, because we follow up on that quite a lot. And I think also we're all a bit more conscious now about making the effort to go outside and get our physical activity and all of that. So, and certainly, yesterday I was out having a walk along the canal, and despite it being quite a miserable day, lots of people out having a walk, people being really good, just walking in twos on their own or with one other person. So I think, that's a really important point to kind of make. But we are keeping close eye on it, and there is some work going on with the combined authority look at traffic numbers and public transport use as well. So it's not just anecdote, we're also trying to keep an eye on what do we really see in terms of cars on the road and people on the buses.
Okay, Ross Hamburger asked probably one of the most popular questions that are going to be around that you probably have to answer in the next few weeks or so. Will there be sufficient vaccine for everyone in Birmingham within 6 months?
Probably not for everyone, I would say, in 6 months. I hope that what we will see over the next 6 months, and the PM has just said, be clear that this is an important step forward, but it does not mean that vaccine from Pfizer is ready to roll off the shelves tomorrow. It still has some more hoops to jump through. Is that within the next 6 months, we will see enough vaccine for the most vulnerable and at-risk people. So care home residents, those of us with long-term health conditions, and to vaccinate the frontline staff, so people working in the NHS and in our care homes and our essential services. I think that is probably achievable with 6 months. I think everyone is probably going to take longer, but we'll see. It also depends on how many vaccines pass through the hoops. Pfizer one, is the first one. There are about 10 the government has backed. If all 10 get through and all 10 are effective, then things can move faster because they bought stock of all of them. If we only get one that works, it'll take a lot longer.
Okay. So Karen and Bill, regarding the business, she was driving in Birmingham between 9 and 10 at night, collecting and then handling a prescription. There seemed to be far more traffic. I think we kind of covered that a little bit more, a little bit earlier. So I'm just going to move on to the next one because we've got a lot of questions coming. So Kate Gordon is messaging and said, when would you be in a position to project which tier we're likely to be after lockdowns lifted? And do you think it will be lifted after the 28-day period? So after December the 2nd, sorry.
So we know there's a lot of national work going on to look at what should the tiers be coming out in December. My personal view is that we probably will end up with at least 4 tiers. So what we're in now would be considered tier 4. What we go back out into, so when we came in, we were at tier 2, but we were definitely looking like we needed to go into tier 3, like Liverpool, Manchester, Oldham. So where we come out of this depends on a couple of things, and they're still deciding what. But from my point of view, I would say infections in over 60s, how good the communities are in complying with the guidance, so how much enforcement action is having to be taken, whether testing rates remain stable or increasing. Those are the kind of 3 key ones that I think will be looked at by government. And if we want to come out back into tier 2 as the kind of minimum, then we've really got to focus on sticking to the rules, because that enforcement one is going to be key. We've got to keep getting tests if we've got symptoms, and we have to make sure we do everything we can to stop spread, particularly in households and particularly in workplaces. And when we look at the over 60 age group, although some of this is care homes, the majority is either people in work or it's people who share houses with each other. Those are the things that we need to control. So it's really up to what we do in the next couple of weeks, which tier we'll come out into.
Okay, we've got a question from Councillor Majid Mahmood. A number of areas such as Oldham and Leicester have had tough restrictions for a long time before the new lockdown, but the rates of infections were still quite high. How can we be sure in Birmingham that we won't be in tough restrictions once the new lockdown has ended? I think you kind of answered that partially.
Yeah, I mean, ultimately, it depends on what people do. You know, we are seeing case rates rise in areas like Alum Rock at the moment. You know, and it's really important that people who get tested isolate and stay at home. And that's probably the big message that I want to give the champions is, you know, we really need to get people who test positive or who are identified as contacts to do what they're asked, because that's how the virus spreads. You know, if you don't leave your house for the 10 days after you test positive, and all the people you live with stay in the house for the full 14 days, that virus is going to stay in your house and die in your house. If you don't, and you just pop to the shops because you ran out of loo roll, or you just pop to take the kids to school, you know, that means the virus gets out of your house, and that's how it spreads. So, you know, I think the big ask is compliance with the isolation. You know, certainly that was an issue in Leicester, and I think was also in Oldham. The other thing that's slightly different in Birmingham is we did start our restrictions earlier. So when we introduced the restriction on household mixing in September, we were at a lower rate than Leicester or Oldham when they went into restrictions. And that's why when you look at the Birmingham numbers, you know, we're going up at a much slower climb than areas like Manchester or Liverpool that just went vertically up. You know, we're taking our time, and that a lot of the thinking nationally is, you know, some of that's about community engagement, the work that the champions do, all the work our faith leaders are doing and our communities. But some of it's also that actually we got in fast enough to be able to slow it down. Whereas actually in Leicester, by the time they started to do restrictions, it was already a bit too late. So we'll see, but it does depend on compliance over the next couple of weeks.
Dan Wood, it's kind of like a personal circumstance where he had a regular blood test at his GP. However, most of the time he had to attend the hospital to get his blood test. But today he was told at the hospital when he went to go and do it, was that they ain't taking anybody from GPs. And so the question is, why isn't this being really clear from the GP practice?
Yeah, I don't know that, to be honest, Dan. And what I'd say is do go back to your practice and point that out. Because actually they shouldn't be giving you a blood test form and then go up to the hospital if the hospital stopped doing blood tests. And unfortunately, because we are seeing so many people going into hospital with COVID at the moment, particularly into university hospitals, Birmingham, they are having to stop some routine stuff. And there are other places you can get a blood test, like the walk-in centre as well. So do give your practice a ring and go, I went to the hospital and they said they're not doing routine bloods. Where do I go? Because if you need a blood test, you need a blood test. But the GP practice should know that the hospital have done this.
Okay. Council management moved back. He's saying Dudley has overtaken Birmingham with the number of infections coming in from a low base as they never entered into tier 2. I don't believe that there's a university in Dudley. So do we know why they have such high rates? And if there is, I think, is there links in terms of plans or opening the Nightingale in the city?
Yeah, so Dudley's kind of interesting because the rates of testing in Dudley were very low, very, very low. And Dudley had some of the lowest testing rates for probably the last 5 to 6 weeks. And then Dudley did a lot of work. They opened some new testing centres, did a lot of engagement, and Dudley's now got a much higher testing rate. And lo and behold, they've suddenly found all their cases. And we were all looking at Dudley kind of going, well, you know, this looks a bit odd because the rest of us have you know, had high rates, and you just haven't been, you know, testing as much, so it must be happening. You know, what's interesting also is that the percentage of positive tests in Dudley is now one of the highest in the region. It's not the absolute highest, but it's well over 16%, whereas in Birmingham we're running at about 14.5%. You know, so it's one of again, one of the things Birmingham did was we opened a lot of testing sites. So our testings remained relatively stable, and it's been pretty high compared to national, which is why we've had a reasonably good grip of what's going on. Dudley didn't have access to the same amount of testing, and so suddenly they've gone through the roof. In terms of the Nightingale, so the Nightingale's over at the NEC Centre in Solihull. The hospitals, I think, are looking at this very carefully. it's not straightforward, because in order to open the Nightingale, you've got to take doctors and nurses out of the hospital and put them into the Nightingale. And once it's open 24 hours a day, 7 days a week. So it's not just like 3 or 4 nurses, it's quite a large number. And although they can look after a more number of patients for a fewer number of doctors and nurses, because these patients aren't quite as sick, it's still not a kind of zero-sum game. It's, you know, it's not quite as easy as it looks. I expect that we probably will see the Nightingales opened over the next 2 weeks. But we'll see how it goes. Certainly the pressure on the hospital is increasing, so it wouldn't surprise me.
Okay, Jason Willits has come in. He's part of a school, and that they use their local park for forest school sessions as part of the curriculum. And they usually take 10 children at a time, and himself and the children value the sessions, but feel that they can't do that because of how this will look to the general public visiting the park and seeing a group of more than 6. Would you advise them to stop those sessions or keep them going?
So Jason, I'd say ping an email through to the education team at the council and we'll give you a formal response on that one. I think you can under the exemptions for education, but I also agree, you know, the public view of this might not be the same. So do you need to think through, and I think it's probably worth getting the official line out of the education department rather than me doing it through the champions session, if that's all right.
Yeah, cool. I think Matthew's just making a comment that is regarding, like, a couple of people mentioned rather than staggered times of school lessons, etc. Can be contributing to that. Rachel sort of brings a question in terms of like people at work as well. This has happened, you know, a couple of people that I know that with individuals who you know, maybe like unconsciously or consciously know that they kind of are positive and spreading it around. So how are we in terms of like from the city council managing our own kind of track and trace system, and how do we and how? Hang on, sorry, I keep saying about my reception. So, how are the Birmingham City Council managing their own tracks and trace, especially staff who fail to recognise their own family symptoms and still go to work? That they're aware of a potential multi-spreader in BCC department.
So first of all, I'd say if you are aware of that going on and you work for the council, then you can report it in confidence through HR, through the HR business partners, or directly to occupational health. Like any other business, if someone goes off sick with COVID or they're isolating, we log it on our HR system, and that's tracked by the occupational health team. And they also then follow up with people to check they're okay and offer any support. We don't do contact tracing internally. You actually, as far as I know, no organisations are doing that for their staff, because that's what NHS Test and Trace is for. But we are keeping a close eye from the point of view of our kind of HR and sickness management to look at that, and to look at also whether we have any clusters of cases in workplaces. The vast majority of the council is working remotely. It's only staff that we actually need to be in. So like bin men, for example, who can't do their job from home, otherwise our bins wouldn't get collected. But we are also just, when we have been continually reviewing, have we got our risk management right and all through that. But as I said, Rachel, if you work for the council and you know this is going on, then please reach out to your HR business partner and flag it so that they can do a bit of an investigation in confidence.
Yeah, I think Rachel just followed it up regarding the member of staff who tested positive, is scared to report it to the job. But they're happy to talk offline with the Ask HR one, so that's cool. Dan has asked, you know, has mentioned that it looks like Christmas is over, so I'm going to try and cheer Dan up. He's put in a couple of questions today. Come on, have we got any positive news for Dan, Justin?
Well, you know, ultimately, this is what we're trying to do over the next 4 weeks. You know, if we all follow the guidelines, if we all get this rate either flat or down, preferably, then there's a good chance that there'll be a window for Christmas to enable people to mix. Probably it will be a small window, so it may well be from Christmas Eve to the end of Boxing Day. You know, it'll be that small. Because it is high risk, and ultimately if people mix like that, we will see case numbers increase. So what the government's trying to do in effect is get the case rate either to flatten or to come down, so that we could actually have 2 or 3 days of relatively freedom, knowing that that's going to cause another spike, and then we'll probably have another period of restrictions. So, I mean, my guess would be we'll probably stay in this till December, then we'll go into a tier system, have a bit of freedom for Christmas, and then possibly go into tighter restrictions in January, on the basis that vaccination is then starting, and we know there's a kind of a semi-end in sight, probably by the late spring.
Okay, so there's a lot to take on it. Thanks, Dan. He's giving you a good clap there, Justin. That's good. Yeah, so Debbie's making the point regarding around different staggered times at different start times for different year groups. Sandra comes in once saying, if a carer becomes ill or is unable to leave the house, what proficient is there for help for with shopping? I think.
So there's information on the council website. If you go onto the council COVID pages, there is information on how you can get help if you are in that situation. And basically there's a telephone number you ring and the council can help either directly, or we do it through one of our voluntary sector partners.
Yeah, Dan has asked the same question. So we'll put that in the guidance with the links on there as well. That will be coming out tomorrow. Just take this quick chance to basically just plug it. The dashboard data will be coming out tomorrow. So Justin has kindly provided some commentary, as he does every week. And so that will be part of a big email that comes out to all of yourselves. And we'll be following it up this week with a couple of texts as well. So Sharon says, for individuals that were previously required to adhere to shielding, what are the most recent requirements? So what's probably the latest information regarding shielding, Justin?
Yeah, so it is slightly different from last time. So what happened was the NHS has written to people who they call clinically extremely vulnerable. And what they've said is you should work from home, basically if you can, and if you can't work from home, then you should be given sick pay support by your employer. And then there's advice about if you do need additional help with things like shopping, then you have to go onto the website and you go through kind of, do you need this, do you need that? That information is then passed to the council, who can arrange the support if needed. Now, there are some differences from last time. For example, the children who shielded last time don't need to shield this time. And that's because we've seen that children who catch COVID, even if they have quite serious health conditions, don't seem to get very sick with it. We don't know why, it just doesn't affect them in the same way. What's different for adults is the inclusion of adults with Down syndrome who weren't previously shielded are included in the list of extremely clinically vulnerable. So that's a change from last time. What I would say is, if you shielded last time, but you haven't had a letter or a text message or an email from the NHS, then you're going to be okay this time. You know, it is a much smaller number of people, and that's because we've learned a lot more about what this virus does and doesn't do. And the advice is, if you get that message, it will tell you exactly what to do. Please follow it, because it's about keeping you safe.
Okay, Justin, I think this is probably like a really important question, kind of a personal one as well, but linking into what Laura said. It's around the topic around conspiracy theories and the impact of what it is. One is around how we're going to promote it, and when people are saying they're not, so the anti-vaxxers at that bit. And the other one, can you just clear up for us in terms of when people are saying, oh, this is just the flu, etc. How does this differ from being the flu?
Yeah, okay. Well, let me start with the flu one first, all right? So both COVID and flu are respiratory viruses. So you both catch them primarily through spread of droplets from an infected person that gets on your hands or directly onto your face. And when you touch your face, the virus crawls into your mouth, up your nose, or into your eyes. So they spread in a similar way. What's different is the way they affect your body. So in flu, generally flu makes people very sick because they get an inflammation of their lungs and fluid in their lungs. They get what's called a pneumonia, and then they have problems breathing, and they ultimately stop breathing. And that's what kills them. Now, COVID is slightly different because COVID does do that, but what COVID also seems to do is it plays around with your clotting system. So people have large blood clots, both in their lungs and in their legs. They can have problems with their general circulation system as well. Now, flu doesn't do that. So they are similar viruses, but they are different. And actually what we're seeing is that the death rate from COVID is higher than it is for flu, particularly in younger age groups. And that's, again, one of the big differences is, you know, flu doesn't generally put people under 65 in hospital unless they've got a serious health condition. COVID is. So, you know, there are some quite different ways it behaves, but they are both respiratory viruses. So you can see why people go, oh, they're the same. Yeah, they're similar, but COVID, you get a lot sicker, and it seems a lot more people get a lot sicker, which is why it is different. And then the second question was around vaccine, wasn't it? About how do we get people to take the vaccine? Well, first of all, no one's going to be forced to take the vaccine. The NHS is quite clear on this. You know, when I'm a doctor, as many of you know, when I used to give vaccines, I have to get consent from someone. I have to say, this is the chemical, this is the vaccine that I want to put in your body. This is what it's going to do. These are the side effects. Are you happy to have it? And you have to say yes. If you don't say yes, I can't give you the injection. So that's why when you get your flu jab, they ask you, are you happy to have it? They have to ask you, and then they write that in your notes. So you have to say, have informed consent from the patient. And it will be the same for COVID. You know, ultimately, there will be some people who say, I don't want to have it, you know, and that's their choice. Hopefully that will be relatively small numbers, because, you know, the reason the vaccine's taking a while is we're checking the side effects, we're making sure it's safe, we're making sure it works, you know. And why wouldn't you take something that could save your life, but it could also stop you catching it and giving it to someone you love? So, you know, I hope people will take it. I think once we have the vaccine, we're going to need to help people, explain people to understand what vaccines are. But that's no different from measles or mumps or rubella. You know we still have to do a lot of work. People get them to trust vaccine. But actually, the reality is this will save lives. And you know, the other side of this is if people don't take the vaccine, we'll still be in restrictions this time next year. Because, you know, there are two ways you control the spread of this virus. You either stop people mixing or you get vaccinated. So, I mean, I'd certainly like to get vaccine, because if I can't have Christmas this year, I definitely want it next year.
Yeah, we don't want to upset Dan on that one. So we've got Adrian's back, and he's agreeing with Carol and Bill that we need to kind of yeah, this is a good point. Is there any other ways and methods that you reckon that we could try and help improve compliance? You know, maybe not even like locally or nationally, or do you know what the plans are from the government that way?
Yeah, I mean, there's quite a lot of research at the moment going on about this, and we're looking at what is why aren't people complying? You know, why aren't people getting tests? When they test positive, why aren't they staying at home? You know, and why aren't people doing what they're asked to do and keep having parties or big funerals? You know, and I think there's a couple of things coming through. So on the testing, people are often scared of what does it mean if I test positive, and they're worried about their jobs and their income. That's why we got the additional payments available for people on low incomes, and there's information on the council website for that. Why aren't people isolating? Well, again, the research says a lot of that's down to money. So that's why there was that financial package there. What we've also got is quite a lot of enforcement. So if you do hear of employers that are forcing staff to come to work when they should be isolating, then please whistleblow. It's anonymous. We will follow it up, because there are specific fines about businesses that behave in that way. I think also some people didn't understand how long to isolate for, and that's why we've started to do a letter to everyone who tests positive to explain how long they need to isolate for, remind them there is a fine, but also remind them there is help, and here's the helpline helpline number as well. So I think that's an important bit as well. And you know, ultimately, I think the final bit is, you know, we are seeing a bit of fatigue. You know, people are fed up with this, and I'm fed up with it like everyone else. And we see people doing stupid things, and whether that's holding a christening party for 60 people or a funeral for 300, you know, they are stupid things to do. And the sadness is that potentially whether they're done for the best reasons or not, that's putting other people's lives at risk. And that's what's driving the spread of this virus. And I think we've got to be quite blunt. You've seen the council being pretty proactive at enforcement. The police are very proactive as well, and what we can do is keep publicising that. But ultimately, we've got to remind everyone that it's the decisions we each make as individuals that put ourselves and our family and the people we love at risk. That's what we're gambling with. It's not, those of you watching are not gambling with my life. You're gambling with the life of the people that you love and care about, that you live with and that you see. That's the risk you're taking. So, we need to help people understand that. And I think anything that you can feed back to us on how we can make that blunter and clearer, then let us know, because I think, that is going to be the key bit over the coming months, is how do we really keep people on board with, you're doing it for yourself and for your family. You're not doing it for Boris or doing it for Keir, whatever your political leanings are. You're doing it for yourself and your family. And that's why we need you to abide by what the guidance are and do the right thing.
Okay, so the last couple of questions, and I'll close it then at this point. And then I think Habib's just got a couple of bits to kind of add to this, which is, Chris Milton goes around the conspiracy theories. What can we do? I know that we've got kind of plans to put out some, some direct messaging to combat a few theories as well. So we'll try and get them done in kind of video form, and so that I think they'll pass through a lot quicker on WhatsApp. To be honest with you, Catherine just asked one. It's about the virus behaviour in itself. If the majority of population have the vaccine, will the virus die out as people won't be passing it about?
That's certainly the hope. What we've seen in some diseases like smallpox is if you can get over 95% of the population vaccinated, then the virus does die out. Then the organism's got nowhere to go. But you've got to get up to about 95% coverage for that to be true. And I think that's going to be ambitious for this one, to be honest. The other thing we've got to keep in mind is that once you introduce a vaccine, the virus knows it's being attacked, and it starts to adapt to the vaccine. And that's what we see with flu. So it's the reason we haven't eradicated flu, actually, is because every year we bring in the vaccine, and the vaccine, basically the flu virus sees it and goes, oh no, I'm going to get a fast one over you on that. I'll come up with a different variation. I'll change my coat again and you won't be able to catch me. So that's the challenge. And there is a real concern that we will see that, and that COVID may well become a bit like influenza. It's a virus we have to learn to live with rather than something we can eradicate like smallpox. But that depends a lot on how effective the vaccine is and how good the uptake is, not just in the UK, but across the world.
Okay, I think Fiona was talking about NHS fatigue with staff, and is there capacity for the NHS to keep going as they're thinking like so a few staff are looking to leave?
Yeah, so I would say, Fiona, it's not just about fatigue in the NHS. I think we see the same fatigue in our public sector staff, whether that's my team, people like Ricky and Habib, or people working in care homes, or Fiona, I know you work for us as well in our education department as well. The public sector is exhausted. And it's been a really, really hard 6 months, and it's going to be another hard 6 to go, I think, before we're really out of this. What I would say is, please encourage everyone to be compassionate. Often when you're tired and exhausted, it's really easy to snap, to write that email that you shouldn't really have worded quite the right way, to send an aggressive tweet, to write to someone in anger, and you never know what the person on the other end is experiencing. So I would say, think with compassion, really encourage people to be a bit compassionate about how hard it is, whether that's your GP and you can't get an appointment, whether it's actually you're not getting the response from the council contact centre that you want. Just take a breath, and breathe out and let some of that tension go, and just think about the other person at the other end, because we really will need a lot of compassion for each other over the coming days and weeks, because it's going to be a while before we're out of this, I'm afraid.
Okay, the last couple now, and then I'll call it quits from there. So no more questions after this, please. So, in terms of the financial support that you mentioned earlier, is anybody following up to see whether it's sufficient to comply with this isolation?
Yeah, I mean, there is some work nationally on this. I mean, we've got to be honest as well about it's not like it's a massive check, but it is something, and it's on top of whatever you're entitled to in terms of sick pay. So it's on top of statutory sick pay or any other benefits. So, you know, I think it's about £500. So, it's not going to rock the world massively, but for people on low incomes, that's a fair amount of money for 2 weeks. It will help. And, I think that the national tension was, well, what can government truly afford? And this is where they ended up. And there's probably a whole load of maths behind it, which I haven't seen. But, certainly I'm getting some personal messages from people who said, actually, it really has made the difference. So please do promote it. We hope it will make a difference. But there isn't, unfortunately, a whole load of extra cash out there.
Yeah, and I think the final point, which was Dace was talking about, these after 2nd of December, are there plans to reopen theatres and museums? I think we've covered that in terms of like the tier section and what that will be. We don't know yet, simply.
Yeah, exactly. I mean, and I would love to see theatres, museums, open again. I was lucky enough to see the Van Gogh thing at the Hippodrome just before we went into lockdown. There's some great stuff that to see in Birmingham, and it would be great also for that sector who really suffered so far this year. But I'm not desperately hopeful, but fingers crossed.
Thank you, Justin, for that. Habib, just got one thing, which was around. What, you're right to come in for a second?
Yeah, sure. Oh, sure. Thank you, Ricky. Thank you, Justin. Just want to say thank you to all the colleagues that joined today and given up their time. Just to ask from us, really, is to ask our champions if anybody would be willing to support our school colleagues around compliance and COVID messaging for the community and the parents that they're working with. We've had quite a lot of issues where schools have raised where parents are not complying with COVID regulations when they're dropping their children after school, coming in mixed households in cars, not social distancing when they're waiting for their children to pick up the children after school. One or two colleagues have already emailed me, so I'd appreciate if anybody's interested, please do email me and we can continue this conversation outside of this, because we are looking for community champions across the city to support and work with our schools to try and get that message across to parents. I mean, if it's coming from a trusted or an influential person in the community, like yourselves, then the community will probably tend to listen more rather than if it's coming from a school sometimes, depending on what the relationship the school has with that community or their individual parents. A lot of schools have said to us that they are getting a lot of grief and a lot of tension from parents when they're challenging them or asking them to comply with COVID regulations and rules. So okay. That's not us, really.
Okay, Habib, we'll put the kind of ask in there, kind of a small task and finish group. It sounds a little bit like with your contact details to kind of continue that discussion.
Please, yeah, do that.
Okay, then, guys. Thank you for joining us this evening. Next week we've got a special one with on the back of that with a colleague from our education department. That'll be at 9 a.m. on Monday morning, so that is actual proper school time. So hopefully that you guys can join us for then, and we'll be in touch shortly. All the best. Good evening.
Good evening. Thank you, colleagues.